Mr. Stupak.
Thank you, Mr. Chairman. During my first campaign for Congress in 1992, I made a promise to my constituents that I would support health care reform and that I would not support the health insurance that's offered to members of Congress until they, all Americans, also had access to quality, affordable health care. I've kept that promise. I hear every day the heartaches of my constituents, the insured, the underinsured, and the uninsured. Those who the current health care system have left helpless, bankrupt, and disillusioned. I want to help all my constituents, but the proposal before us perpetrates a broken system. On this health care proposal, the CBO said yesterday that by 2016, 7 years from now, maybe 97 to 98% of Americans will have health care. CBO said the legislation does not address the inequities in the current system, and health care savings will come only through the public health insurance option by reducing payments to health care providers. A public option dictated by an unnamed health care czar, unchecked powers found in Section 123 and 141 of this legislation. CBO said the current legislation will cost us hundreds of thousands of jobs. So to the young mother from Hillman, Michigan, who just lost her job and was just diagnosed with multiple sclerosis, she will not begin to receive any help, if any, under this plan, and for her $2,500 per month injectable MS medication until maybe 2016. Or Mr. Powell, who's outraged by being charged $3,567 for a cortisone shot he received this past January. CBO says the inefficiencies, like Mr. Powell, will increase as savings is achieved by cutting reimbursements, in other words, by cost shifting going to patients on private pay. If the reimbursements continue to be cut, which healthcare providers will continue to see patients? In my rural northern Michigan district, we can't attract enough healthcare providers now, and one reason is because low reimbursement rates. Without a requirement that healthcare providers must take all patients in the public option plan, the public option plan is really hollow, and the underinsured will be perpetuated. Without real competition, like remove the insurance industry antitrust exemption, does the public plan ever offer lower health care costs? Without an end to balanced billing to the patient, cost shifting will go on. All Americans will pay more, and Mr. Powell will continue to pay more than $3,500 for a cortisone shot. So with the bill in its current form, there's no competition to provide health insurance. The bill does not address the inequities, the inefficiencies we find in Medicare and Medicaid, and cost shifting will continue. My constituents' concerns are not addressed. I'll listen carefully and support those amendments that provide for accessible, affordable, and efficient health care insurance. And of course, we haven't even addressed the sanctity of life issue yet. I appreciate the efforts of all those who've worked on this legislation, but I cannot support this bill in its current form. I yield back the balance of my time.
The gentleman yields back his time.